Let's see an NCLEX RN video based on care for patients with hepatic disorders. The nurse correlates which laboratory data to decreased liver function secondary to liver cancer or cirrhosis. Elevated serum globulin level, elevated serum ammonia level, elevated serum protein level, elevated serum amylase. Laboratory data collected to determine liver dysfunction includes an elevated serum ammonia level. Elevated amylase indicates pancreatitis, and elevated serum globulin and protein may be indicative of nutritional issues or other diseases which are non-liver related. The nurse caring for a patient with liver failure notes a change in mental status and elevated ammonia level. Which ordered interventions are most directly related to treating these clinical manifestations? Diuretics, high protein diet, Coumadin, lactulose and neomycin. Interventions to decrease the buildup of ammonia in the body includes laxatives and antibiotic therapy. So lactulose and neomycin. The antibiotic neomycin helps decrease the amount of bacteria and the laxative helps remove the toxins from the body. Protein restricted diets are important with liver failure. Diuretics are used in liver failure for fluid overload, not because of increased ammonia levels. And Coumadin is a blood thinning agent not utilized in a patient for elevated ammonia levels. The patient just returned from the procedure area after having a liver biopsy. The primary nursing intervention includes which action? Ambulation, monitor BP and assess the site for bleeding, heparin drip, obtain a culture from the biopsy site. Nursing interventions post liver biopsy include BP monitoring and the site assessment, as there is the potential for bleeding post procedure due to the vascularity of the liver. A patient with liver disease is being evaluated for varices. The nurse prepares the patient for which procedure? Liver biopsy, EGD, that is esophagogastroduodenoscopy, ERCP, that is endoscopic retrograde cholangiopancreatography, and TIPS. TIPS is transjugular intrahepatic portosystemic shunt. So an EGD, that is esophagogastroduodenoscopy, is the diagnostic procedure where an endoscope is placed to the patient's mouth into the GI tract to visualize the upper GI bleeding caused by esophageal varices. While the other procedures listed are often times used in patients with liver failure, they are not used to evaluate the varices. A 17-year-old patient sustained blunt abdominal trauma, was hit in the abdomen with a baseball bat, and is being discharged home after 24 hours of observation. Discharge planning includes which teaching? Defense maneuvers, antibiotic teaching, education about abdominal signs and symptoms of increased pain, tenderness, limit solid food intake. It's important that the patient understand that the increased pain or tenderness can be indicative of a complication of the trauma and should be reported immediately to the healthcare provider. So we need to educate about abdominal signs and symptoms of increased pain and tenderness. The nurse recognizes which patient is at greatest risk for type 1 autoimmune hepatitis. A 45-year-old postmenopausal female a 30-year-old female with a history of hyperthyroidism, a 16-year-old female with type 1 diabetes mellitus, a 12-year-old female with autism. Type 1 autoimmune hepatitis occurs most frequently in females during adolescence, and these patients usually have other autoimmune disorders such as type 1 diabetes, Graves' disease, ulcerative colitis, or proliferative glomerulonephritis. Type 2 autoimmune hepatitis is less common and affects girls between ages 2 and 40. In reviewing diagnostic results of a patient with suspected hepatitis, the nurse correlates which result as consistent with hepatitis A. Prolonged prothrombin time, decreased WBC count, presence of IgM anti-hepatitis A virus, detectable serum hepatitis B virus DNA. The most definitive diagnosis of hepatitis A is through a blood test for the presence of anti-hepatitis A immunoglobulin M, IgM anti-hepatitis A virus. Acute hepatitis B occurs after an incubation period of 4 to 10 weeks, and chronic hepatitis B is diagnosed by detectable serum hepatitis B virus DNA levels and persistent elevation of ALT and AST levels. Elevated ammonia levels can lead to hepatic encephalopathy, which provider order best reduces this risk in patients with cirrhosis. Administer furosemide and spironolactone, administer antibiotics, restrict protein intake, restrict caloric intake. Encephalopathy is caused by accumulation of toxins in the liver, one of which is ammonia. Ammonia is produced when proteins are broken down by the body. In patients with cirrhosis, the liver is not able to clear these toxins from the body. Thus, it is important to restrict protein intake in the diet. In a patient with cirrhosis, the nursing diagnosis, risk for injury and bleeding related to prolonged clotting factors is most appropriate related to which disorder? Pruritus, vitamin K deficiency, hyponatremia, ascites. Patients with cirrhosis have a decrease in the synthesis of bile salts. The liver makes clotting factors which rely on the presence of vitamin K to function normally. Vitamin K is a fat-soluble vitamin that requires the bile salt to be absorbed properly. In cirrhosis, there is a decrease in the bile salts and decreased ability to absorb vitamin K. The nurse assesses for which clinical manifestation in the patient diagnosed with liver cancer: periumbilical pain, anorexia, hemoptysis, fatigue, jaundice. Because the tumor typically impairs the normal functioning of the liver, the patient exhibits abdominal pain, weight loss, anorexia, weakness, fatigue, jaundice, and ascites. Pain is typically in the right upper quadrant. Hemoptysis is associated with bleeding esophageal varices. So here, with liver cancer, they show anorexia, fatigue, and jaundice. Which statement by a patient diagnosed with liver trauma indicates understanding of the prescribed plan of care? I will need a liver transplant. I will need a blood transfusion. I am at increased risk for infection. I will never be able to drink alcohol again. The liver is a highly vascular organ. Traumatic injuries to the liver include lacerations, contusions, and hematomas. Patients required fluid resuscitation, frequent hemoglobin monitoring, and the possibility of blood transfusion. So the patient need to tell, I will need a blood transfusion. Mr. Green, a 17-year-old, presents to the clinics with anorexia, generalized weakness, malaise, and weight loss. He has type 2 diabetes mellitus treated with metformin XR1 500 mg once per day. His past medical history includes IV drug use and currently he describes drinking 2 to 3 beers per day. Several hours after Mr. Green attended a cookout with family members, he became confused and started saying things that did not make sense. His confusion worsened the following day and he complained of shortness of breath and had an episode of upper GI bleeding. He was admitted to the hospital for a workup which revealed high serum ammonia levels and esophageal varices. Mr. Green is admitted to the unit for further follow-up. On physical examination, he is responsive to questions and is oriented to person and time, but not place, and is mildly confused. His BP is 91/43 mmHg and his heart rate is 100 beats per minute. He complains of slight shortness of breath with a respiratory rate of 24. His oxygen saturation is 94% on 2 little nasal cannula. He is afebrile. His abdomen is very large and distended and the nurse notes the presence of veins throughout the abdomen. He complains that his clothes are too tight and it is hard to lie flat on his back. He has to sit in a semi-upright position. His arms and legs are covered with scarring from his former IV drug use. His pupils are reactive and equal and his sclera are slightly yellow, as is his skin. He states that his urine is very dark. Diagnostic tests reveal chest X-ray indicates small bilateral pleural effusions. Electrocardiogram reveals sinus tachycardia. LFT is elevated greater than 4 times the normal range. AST is 220 international unit per liter and ALT is 185 international unit per liter. Bilirubin levels are twice the normal range. Total bilirubin 2.8 mg per dl, direct bilirubin 1 mg per dl, prolonged INR, elevated serum ammonia levels, low albumin level 3 gram per deciliter. Mr. Green is diagnosed with liver failure. What clinical manifestation does Mr. Green display that is consistent with the diagnosis of liver failure? Yellow sclera, arm and leg scars from IV drug use, tachycardia, high BP. Yellowing of the sclera is a classic sign of liver failure. Scarring from IV drug abuse could be a risk factor but not a means of diagnosis. Tachycardia and high BP can have several clinical manifestations that may not be consistent with liver failure. Which clinical manifestation experienced by Mr. Green will be relieved by paracentesis? Jaundice, dyspnea, diarrhea, decreased urine output. Paracentesis involves draining of the accumulated ascites in the peritoneum which can push up on the diaphragm causing shortness of breath. So here it is dyspnea. Which order will the nurse anticipate for Mr. Green? Increase iron intake, strict bed rest, placement of an indwelling urinary catheter, restrict sodium to 2 gram per day. Patients with ascites have a high sodium balance. The sodium restriction is indicated along with diuretic therapy. There is no indication to increase the iron intake or for placement of an indwelling urinary catheter. While rest is important, strict bed rest is not indicated. So here we need to restrict sodium to 2 gram per day. Which information did the nurse include in teaching of Mr. Green about the diagnosis of liver failure? Avoid food high in fat, avoid foods high in protein, need for oxygen when he is discharged, need for antihypertensive medication. Patients with liver failure should eat a balanced diet. Too much protein in the diet will result in an increased amount of ammonia in the blood. In liver failure, the liver is unable to process this ammonia and can lead to changes in the mental status. So here you need to tell about avoiding foods high in protein. Based on Mr. Green's most recent clinical presentation, which finding is the priority that the nurse needs to communicate to the healthcare provider? Temperature, worsening mental status, inability to lie flat, BP. A worsening mental status in the patient is an indication that the liver is unable to process toxins that cause altered mental status. All vital sign monitoring is important. Worsening mental status may indicate worsening patient status. So you need to check for worsening mental status. Hope you understood this video. Thank you so much. Keep to watching for more videos.